Hi, I'm Avalue PM Rus. I'm responsible for Avalue Smart Healthcare Solutions. Today, I will show you Avalue Telemedicine Cart Solution. First of all, we know we are all suffering with COVID-19 now. Since it's hard to travel to different countries, we cannot meet each other face-to-face. COVID-19 also impacts the healthcare industry seriously, since no one wants to go to the hospital. Therefore, telemedicine becomes a quite hot topic and increasing demands in most of the countries. Today, I would like to show what Avalue solution can provide. First of all, I would like to talk about what is telemedicine. Telemedicine is the distribution of health-related services and information via electronic information and telecommunication. It allows long-distance patient and clinician contact, care, advice, reminders, education, monitoring, and remote admissions. Or simply speaking, you don't have to go to the hospital to see the doctors. Telemedicine is used in a more limited sense to describe remote clinical services, such as diagnosis and monitoring. When rural settings, lack of transport or lack of mobility, decreased funding or lack of staff restricts access to care, telemedicine may bridge the gap to synchronize online information and health data management and healthcare system integration together. Telemedicine could include two clinicians discussing a case over video conference, or physical therapy done via digital monitoring instruments, live feed and application combinations, or remote monitoring through continuous sending of patient health data, or even video phone interpretation during the consult. So, what's the benefits of telemedicine solutions? I would say efficiency, real-time, and contactless. Telemedicine can be beneficial to patients in isolated communities and remote regions, who can receive care from doctors or specialists far away without the patient having to travel to visit them. Recent mobile collaboration technology can allow healthcare professionals in multiple locations to share information and discuss patient issues as if they were in the same place. Remote patient monitoring through mobile technology can reduce the need for outpatient visits and enable remote prescription verification and drug administration oversight, significantly reducing the overall cost of medical care. It may also be preferable for patients with limited mobility. Telemedicine can also facilitate medical education by allowing workers to observe experts in their fields and share best practice more easily. Telemedicine also can eliminate the possible infection between patients and medical staff. Especially now for COVID-19, it's really a concern. Additionally, some patients who feel uncomfortable in a doctor's office may do better remotely. They may prefer to stay at home or in the institution. Okay, let's have an overview of Avalue Telemedicine Cart Solution. As you can see on the screen, they are the key components of telemedicine solution. From top to down, you can see a PTZ camera, a high-quality camera, a medical all-in-one panel PC with expansion power bank at the rear side, and a speakerphone on the desktop, a high-quality speakerphone, and of course, the medical-grade cart itself. It holds and fixes every component well and easy to move. And optional medical devices such as horoscope or other kind of USB or Bluetooth medical device depends on the healthcare purpose. I will introduce each component later. For the medical-grade all-in-one panel PC, we provide two kinds of choices. One is 21.5 inches, and the other is 23.8 inches. Both of them are true flat front panel and super slim design, which is very easy to clean and use. They are both UL 60601 certified, antimicrobial finish traces, fanless, and front IP65 rating. Besides panel sizes, the main difference is that if you need a handset with a VoIP function, or you need isolated USB port, COM port, or LAN port to connect with other medical equipment, you should use a HYD21. If you need a hot swappable battery for longer operating time, or you need a better CPU performance to run more software programs, then you should choose the HYD23. Okay, power system is quite important for mobile applications. We knew that sometimes it's hard to deal with the battery packs, since battery always has its lifetime limitation for charging and discharging, which means users have to buy new battery pack every 1 or 2 years, depends on the usage. Avalue provides a battery box with a VESA mount as an expansion power bank. It can be fixed at the rear side of the medical panel PC, and the battery pack is hot swappable. The 2 battery pack can be supported to the medical panel PC up to 7 hours, and you can replace the battery pack to sustain longer operating time. As you can see on the screen, you can use hand to unfasten the 2 screws to open the cover and replace the batteries. For the I/O port, they are very simple. 1 DC input for charging, 1 USB for PC console, and 1 DC output for all-in-one panel PC. The DC output supports the second power output via our dedicated white cable, which can support the power input for the PTZ camera. Avalue also provides the management console app, so users can monitor the battery status on the screen. The most important thing is the certification. This expansion power bank is IEC 60601 certified, which will provide both our quality and the safety for this telemedicine solution. Next, high-quality camera and speakerphone are very important for telemedicine solution because remote medical professionals are all rely on these important peripherals to see and communicate with the patients. Let's check the PTZ camera first. PTZ comes with a pan, tilt, and zoom functions. It supports 12 times optical zoom, auto tracking, autofocus on human face, and true color image. The image color is quite important and critical for doctors, since they need to see the real color of patients, especially the wounded detail or the skin status. The PTZ camera was qualified by many doctors already. Then we check the speakerphone. During COVID-19 period, I believe you have a similar experiences that sometimes we have to do the conference call with other guys in the public space. If you use a low-quality microphone and speaker, the others cannot hear you very well, since there is too much noise from the background. That's why we use a professional speakerphone to have loud and clear sound. This speakerphone has a built-in omnidirectional microphone, so that remote doctor can hear the voice clearly. And there is an additional feature for this speakerphone is that the AI noise cancellation. This function can suppress over 200 types of noises. Then we can hear the clear voice as we want. After knowing the components of this telemedicine cart solution, I would like to show you what kinds of application we want to approach. First, of course, it is remote clinics. With the telecommunication technology and medical devices, such as a digital horoscope, it is more easier for patients and the medical professionals, and as well as a follow-up, which will save a lot of cost for both each other. Second is the medication-assisted treatment. MAT is a treatment of the OUD with medications, often in combination with behavioral therapy. As a response to the COVID-19 pandemic, the use of telemedicine has been granted by the Drug Enforcement Administration, to start or maintain people OUD by telemedicine without a need for an initial in-person examination. Third, emergency care. Sometimes there's not enough medical professionals in the emergency room, or they need to consult with other professionals. Telemedicine solution is quite helpful in this case. Fourth, telerehab. It can deliver therapy to people who cannot travel to a clinic because a patient is disabled or because of travel time. Telerehab also allows experts in rehabilitation to engage in a clinical consultation at a distance. Fifth, telenursing. This application has significant growth rate in many countries. Telenursing can provide nursing service in healthcare whenever a large physical distance exists between patients and nurse. The benefits are serving increasing shortage of nurses, save travel time, and to keep patients out of hospital. The last one is online learning. The interns can observe and learn the practice with medical experts together remotely. It is quite suitable for university hospitals to bring more opportunities to enhance their knowledge, skill, and experience. Okay, I believe you already have a clear picture of Avalue Telemedicine Cart Solution. We are promoting this solution and have the solution EDM available now, as you can see on the screen. If you are interested in this solution, or if you have any question, please feel free to contact us. Thanks for your time today.